There's a lot of development now in acute myeloid leukemia, and the 4 drugs were approved last year by the United States FDA. These 4 drugs were a FLT3 inhibitor, Midostaurin, which was approved in combination with induction chemotherapy in newly diagnosed frontline FLT3-mutated AML, including both FLT3-ITD, FLT3-D835. This approval was based on improved overall survival in a phase 3 randomized study. The second agent that was approved was a IDH2 inhibitor called Enasidenib, and this approval was for people who had a IDH2-mutated, which makes about 8 to 12% of acute myeloid leukemia patients, and for a relapse setting. And this approval, actually, one of the unique things was it was actually approved based on an extended phase 2 study. And I think that was very appropriate because the drug was safe, it's oral, and it showed 35 to 40% response rates, and people who had a response had improved survival. And since this is such a narrow targeted group, based on the theme of precision medicine, the FDA did consider and approve this agent in relapse patients with IDH who would otherwise have very limited options. The third drug that was approved was actually an immune-based therapy. So the first 2 were targeted, this one is more immune, and it was a agent called Gemtuzumab, ozogamicin, also called Myeloid. It's basically a antibody-drug conjugate, and it has a antibody that is targeted towards CD33, which is expressed in 95 to 100% of acute myeloid leukemia. And the toxic payload was a bacterial toxin, killichomycin. And so this antibody basically will latch on to CD33, which is more expressed on AML cells, and then deliver the toxin into the cells, resulting in the death of the cells. And then the fourth agent that was approved was actually a new formulation of chemotherapy, so not a targeted molecular therapy, not an immune therapy, but it has a fixed encapsulated liposomal formulation of 2 drugs that we use frequently in AML, Cytarabine and Daunorubicin. But in that fixed liposomal formulation, these drugs had a better chance at penetrating into the bone marrow and accessing the leukemia blast. And in a large phase 3 study done in a subset of AML, patients with secondary AML, so these are patients who have AML arising from a pre-existing MDS or from a pre-existing aplastic anemia, or AML that arises from prior chemoradiation for another solid tumor, lymphoma. So in that subset of patients, they showed that the agent called Vyxeos, or CPX351, had a significant improved survival as compared to the standard of care 3+7. And so now in the United States, if you have a patient with secondary AML or therapy-related AML, we're using the Vyxeos as a standard agent. The approval actually allowed for all ages patients, so it can be used in any secondary AML. So these are the 4 that are on the market, used in the US. Many of them are coming or have been approved recently in Europe.